Now coming on to suturing techniques, what we will need first is our suture holder, on which we will place our suture pad. For basic suturing techniques, we will use our CS dotted suture pad. Once we have placed it in the center, we can fix its position by using push pins provided in the kit bag. 4 push pins at the 4 corners of the suture pad are enough to avoid any movements while suturing. Apart from this, we will also require a needle holder, a toothed forceps, a scissors, and a suture thread. Now, with the help of a needle holder, we will pull out the needle slowly so that we have the entire length of the suture thread with us. So we will be starting with simple suture. Now you have 2 holes that are marked on the suture pad. The technique is to put the needle in from one of the holes and you come out from the opposite hole. These are 2 equidistant holes. The important thing that you need to make sure that your needle is going perpendicular to the tissue, avoiding trauma. If you find it difficult to come out from the opposite end, you can also come out of the midline. With the help of a forceps, you grab hold of the shaft of the needle and pull it out. With the help of a needle holder, you are just stabilizing the tissue while you are pulling the needle away. You need to place the needle away safely and then you pull the thread. Make sure you leave adequate amount of thread for tying. Again, the technique of tying is similar to what we did for an instrument tie. You just rotate the thread onto the needle holder twice, then you grab hold of the short arm with the needle holder and you slide the thread. You can see the edges are getting approximated. Now, to achieve a reef knot, you wound the thread in the opposite direction, a single throw, and you grab hold of the end and tie it off. You need to make sure that the knot is not coming onto the suture line and it's on one of the sides. Once we are done with the knot, we can just cut it using a pair of scissors. Make sure you leave an adequate amount of stump so that you can hold it and remove the suture whenever needed. Now assume there is a wound which is this big in length and we will be suturing it. Here we will be looking at simple interrupted sutures to close this wound. Again, you will require a needle holder, a toothed forceps, and a scissors. The technique is similar to a simple suture. We are going in from one hole and coming out from the opposite hole, stabilizing the tissue while pulling out the needle and placing it aside safely. And we are also leaving an adequate amount of suture thread so that we can tie at the end. We are scaring the knot so that the tissues get approximated, and then another knot in the opposite direction to tie it down. We can see we are rotating the thread on the needle holder and grabbing it with the end. We are not pulling the short end at all and we are just sliding the thread with the other hand. Once this is done, we will cut the thread, leaving behind an adequate thread of approximate length of 1 cm so that it can be held again whenever we need to remove the suture. Make sure that the needle is handled with care and it does not poke you. use the needle holder and the forceps while handling the needle. Now, we will repeat the procedure. We will be taking multiple simple sutures over the entire wound length. This pattern will form our interrupted sutures pattern. Make sure you're not touching the tip of the needle because that could damage the needle and make it blunt. As mentioned, we will continue taking simple sutures along the entire length of the wound. You can see the wound is very well approximated. You need to make sure that your knots are on one side and not on the suture line. Knots tend to irritate the wound and delay wound healing and can also cause an infection. Another thing you need to make sure is that the tissue should not be approximated too tightly because the edges might invert and necrose, which might lead to an infection. If the edges are getting inverted and not averted, then the two epithelial surfaces will not heal properly and we will take time. We will now demonstrate simple continuous suture. Again, it is similar to a simple suture, but it is a quicker way to suture and suture removal is easier. Again, the technique is similar. The first stitch is similar to taking a simple suture where you go in from one hole and come out of the opposite hole. So this is your first suture, and over here you will not cut the end but rather continue suturing. The direction is the same, going from right to left. We keep doing this for the desired length. You do not need to pull or push anything out over here. And whenever you want to tie the suture, you just have to pull it and the tissue will approximate. The advantage is that this suturing is faster, but the disadvantage is that even if one of the knots or end cuts or any cut throughs happen, your entire suture line gets compromised. Whereas in simple suture, even if one of the suture gives away, the remaining sutures are still holding on the tissues. At the end, it is again a simple instrument tie. So here we keep whatever length of the loop you want and you can tie it off. And cut. This is how the pattern looks for simple continuous sutures. These sutures are similar to simple continuous sutures. You first start with a simple suture. The knot should be on any one side. With a simple suture, you cut both the ends, but here you will just cut the short end and you will keep the long end and you will continue suturing just like a simple continuous suture. The only difference here is that you will be interlocking every loop as you suture. You will leave a loop like this and you will pass your needle through the loop in such a way that the thread is getting locked. Just like you can see. You will maintain your traction on this locked end. Which normally a assistant will do. If the traction is lost, the wound will open up. We repeat the same thing where we will pass the needle through the loop and we will gradually pull it and lock it. Again, the assistant will hold the thread. By repeating the same procedure. Make sure you don't give up on the traction till the end, because if you lose it, the entire suture line will become loose. So maintaining traction till the end will ensure that we get a good closure of the wound. Lastly, we will tie a knot again on the same principles of continuous sutures. But the only difference is that we will not pass the needle through the loop. We will leave the loop as it is. Generally, a small loop that you can leave, and then you can do an instrument tie. And finally, cut the thread. So these are simple interlocking sutures where all your threads come in one line and your midline is closed. So now we will be demonstrating a vertical mattress suture. It is also called a far near suture. The technique is that you will be going in from far and coming in from far. Now here what we will do is we will rotate the needle and hold it in the opposite direction and go in from close the edge and come out close to the edge on the opposite end. And then we will tie our suture. This is your vertical mattress. Normally, you take fast sutures approximately 1 centimeters away from the edge and take a deep bite so that you take an entire chunk or bulk of tissue, followed by the superficial or near sutures which are taken approximately 1 to 2 millimeters from the edge. So when you tie this, you get this sort of a pattern. This kind of sutures are good for when you have tissues or suture line which is under tension, because here the deep tissue bulks are getting the tissues together so that there is minimum tension on the suture line, and also the near sutures make sure that the edges are properly everted. So again, a deep bite, which is far, followed by near bite, near bite. What you get in a vertical mattress is a row of horizontal sutures which are getting the tissue into the midline. This suture type is not preferred for cosmetic or cosmesis because they tend to pull the tissues and keep them under tension. Now we will be doing a figure of 8 suture. This is normally done for bleeders that are difficult to catch or are difficult to identify. So here what we are doing is just like a simple suture. We will be going in from one end and coming out of the other. What we have done is we went inside from one end and came out from the center, and then again going in from the center and coming out of the opposite end, like the figure 8. Again we will rotate the needle this time from the opposite side. We will go in and come out from the center and again go in from the center and come out from the opposite end. We have formed a pattern of 8. And then you tie this up and your underlying tissues will be approximated, pressing onto each other, giving proper hemostasis. This technique will bury the bleeder inside. We saw how the two ends in a cross pattern were tied together. Again, this technique is not cosmetically good, so it's not preferred to be done on the skin. Now, we will be demonstrating a pox stitch, which is basically done for any bleeders which are bleeding and you cannot identify it properly in the tissue. We will start by taking a simple suture. Here what we are doing is turning the needle to the opposite side and passing it. This is more or less similar to the horizontal mattress suture, which you will see in the next advanced suturing section. Because here the tissue is in the center, we will get approximated or get pressed with a suture line, which will give you proper hemostasis. See how your internal tissue has propped up and it has pressed all the tissue from the center. This will help you in achieving hemostasis.